If you have a cough that just won't go away, but you never really feel like it's serious enough to visit your doctor, lucky for you, our doctor is in this morning. It just may be time to get it checked out. Medical correspondent Dr. Jennifer Ashton is back with some of the possible reasons for a chronic cough. It seemed like there was a lot of this going around actually this winter, the cough that wouldn't go away. How do you know that it's something like a cold and not allergies?
Well, listen, Erica, in medical school, this is one of the actually most difficult things doctors have to learn about because the differential, as we call it, is so long, and not every cough comes from the lungs. Sometimes it can come from the stomach or GI tract. Sometimes it can come from the heart. But when you talk about just this time of year, yes, a lot of people have colds. Upper respiratory infections is the medical term, but we're also starting to see some allergies. And of course, you can see allergies at any time of the year. Really, the key difference is that people who suffer from allergies usually have other symptoms. They might have some itchy eyes, they might have a stuffy nose. People who have colds tend to feel pretty crummy. So again, it's usually how you're feeling if you've been in contact with anyone who's been sick.
Yes.
Obviously, that would be a clue that it's a cold and not allergies, but definitely the symptoms can overlap.
There can also be, though, different things which are actually a chronic cough, and these are a little bit more serious.
Right.
I know you wanted to walk us through some of those. The first one is COPD, and this is something that could happen to a lot of smokers.
Correct. Chronic obstructive pulmonary disease, the vast majority of the time is caused by smoking. So if you are a smoker and you develop a cough, that is one more indication. It's your body telling you it's time to quit. Mm-hmm. But what happens in COPD is the linings of the sacs of the lungs really get destroyed. They produce a lot of mucus. Anytime you've heard the smoker's cough, that's oftentimes associated with COPD. But a regular cold can make COPD worse. COPD can actually make a cold worse because, again, of that overlap. So if you are a smoker and you have a bad cough, you want to get it checked out.
Definitely see your doctor. Also, is it GERD or GERD? Which one is it?
So gastrointestinal reflux disease or heartburn, very, very common overlap or cause for a cough because, again, the windpipe and the esophagus sit right in front of one another, and a lot of times when that acid comes up into the esophagus, it can cause a cough, especially at night. So people with reflux also may have some heart disease, some burning in their esophagus, that heartburn. So don't automatically assume that your cough is coming from the lungs. It could be coming from your stomach.
It could be also, we talked a little bit about this in the beginning, but let's come back to the colds. If you're just getting over a cold and you feel kind of, it's like that post-nasal drip.
Right.
The clearing out phase, as I like to call it, can make you cough a little bit more.
Yes, it can. And you know what? I hear this from a lot of my patients, Erica. They'll get an upper respiratory infection. Then they'll have that residual cough, which can be pretty violent at times, that hacking cough. Sometimes it wakes people up from sleep. And they'll say, I have bronchitis. And they'll immediately want a prescription for an antibiotic. True bronchitis really lasts several weeks or even months.
Wow.
And yes, it can require antibiotic treatment, but usually that cough after a cold is just your body's natural reaction to clear that mucus, clear out the linings of the lungs, and it can be pretty annoying.
Thanks for clearing this up.
Pardon the pun.
Pun intended. Jen, thanks. Always good to have you here.